Hello, ma'am. Good evening. Thank you so much for this opportunity and you take your time. Thank you so much for giving your time.
My pleasure. Totally my pleasure.
Yeah. So, ma'am, how's going life?
Life is good, great, but a bit hectic.
How is this pressure like nowadays? People in NEET PG preparation, there is so much pressure. How was the pressure during your days, your
Uh,
medical days?
During my days, I am very sure it was not as um as tensed as you are all now. When I think I'm quite old when compared to most of you here. So during those days, it was not NEET PG, but it was All India entrance and state entrance. Um, quite frankly, I did not work as hard as you people are all expected to do. Um, we didn't have so many platforms. We didn't have so many online platforms. We didn't have so many offline sessions. So it was mostly we preparing for the exam. And of course, we used to take a few support. I studied in Speed Medical Institute. That was the only institute for the whole of Tamil Nadu at that point of time. And even that, I did only a crash course. I must have attended like 50% of the sessions during those days. And then I wrote straight away the exam. So I'm sure it was not as competitive as it is now. So hats off to all of you for facing this. I won't say this is a period of stress. If you ask me, I would say this is a golden period in your life. I will tell you why later on. Still hats off to you for facing the stress at such a young age. It was not as stressful as this at that point.
Yeah, because of teacher like you, थोड़ा stress कम हो जाता है इस time पे आके. Yes, ma'am. So, ma'am, for the NEET PG 25, we have approx 5 months, 5 to 6 months. So, how should we go for that?
Yeah, so the tentative date has been released for NEET PG 2025. Every time I hear the adjective tentative, I myself get stressed. So I can totally understand how much you're all stressed about it. Let me start by asking you all one question. Before you get into any task, you should set a goal for that task, right? So what is your goal? What is the goal that you've set for yourself? When you can raise your hand, you can unmute yourself and you can start answering. What is the goal that you have set for yourself? Can I hear it from Shagun? Because your face is seen first for me. My apologies for my voice. I had a bad.
Hi, ma'am.
Hi, Shagun.
So my goal here is to get a radiology seat by the end of these 6 months, and definitely start my PG in radiology somewhere.
Great to hear somebody have a clear set goal for herself. Great. Manjunath?
बाकी लोगों में तो अभी रेडियोलॉजी जैसा कॉन्फिडेंस आ नहीं पा रहा है.
I know many of you would want to get into radiology. Can anybody else unmute yourself and answer? Komal?
Guys, make it interactive, like you can unmute yourself, you can answer in chat box also.
It's very rare for me to be able to interact with students, because otherwise if it's an offline session, it will be like 100 students right in front of me. I would just go. It would be a monotonous delivery of lecture. So thanks to Dr. Deepak for me being able to interact with all of you. Komal, yeah, she has unmuted yourself.
Right. So, ma'am, right now I'm not sure what branch should I take. So
Okay.
my target is just to score a decent rank, and then I will decide.
Good. I like that part of goal also, to get a decent rank. Great. Ram says he wants to get into dermatology. Gagan Gowda, can I hear it from you? Probably then I will start speaking.
Yes, ma'am. I need to choose medicine in any magistrate college.
Great. So those days, my ambition was also to get into medicine. I'll tell you all about my story later on. So it's good to see you all have surgery from Andhra Medical College, radiology, dermatology.
I'm planning to do general surgery, ma'am.
General surgery, general medicine. It's really good to see you all have such well set goals. So let me tell you, OBG, great. Shanti wants to do OBG. So if you ask me what kind of a goal that you should set for yourself, I'm not debating on the goal that you have set for yourself. I would say the goal that you set for yourself should not be in terms of the course that you want, should definitely not be in the terms of the college that you want to get into. And it need not be in terms of the rank or in terms of the mark that you need to get. I can see MS ENT, great, Shriyos. Good. I would say the goal has to be ultimately for you to become a good clinician. Will you all agree with me on that? Irrespective of the domain that you choose, irrespective of the college that you get into, the ultimate goal for all of us would be to become a great clinician, right? So when will you be able to become a great clinician? I would say that is possible only when you have a conceptual understanding of all 19 subjects, right? This is why I said this is a golden period in your life, which is provided exclusively for you to have an understanding of all 19 subjects, because you have learned all these 19 subjects in bits and pieces throughout your undergraduation, right? What happened in your first year? In your first year, even before you could understand what is anatomy, what is physiology, what is biochemistry, I'm very sure you got bombarded with internal assessments. Am I right or wrong? Right? And so what you would have done is you would have discussed with your seniors, you would have gotten an information on what are the important questions. You would have tried preparing for your internal assessment. And even before you could understand how to prepare for an internal assessment, I'm sure you got bombarded with university exam. Again, what did you do? You got all previous year question papers. You knew what is the frequently asked essay question, frequently asked short notes. So you would have prepared yourself for such an exam-oriented way. Was it any different in your second year? Even after you got into your clinics, what would have happened is you would have gotten interested in clinical subjects, right? You got exposed to medicine, surgery, OG. So you got interested in all those subjects. And even before you could realize, again, a university exam with pathology, microbiology, pharmacology. So what you would have done the same thing. So don't be harsh on yourself. Don't think that it is only you who did not do a great undergraduation period. It is applicable to everybody, even those who have gotten a gold medal, distinction, multiple distinctions. They would have also done a similar task, probably in a better way. So all of us have an understanding of all these 19 subjects in bits and pieces. With bits and pieces of information, will you be able to become a great clinician? My answer is no. Right? So we are bestowed with the responsibility of a life of a person, but that's a power, right? With great power comes great responsibility. So when you know that a life is going to be a responsibility, then you should understand the gravity of the responsibility that you have. So I would say for you to become a good clinician, you should have a conceptual understanding of all these 19 subjects, and that should be an A. Right at the end of the upcoming 5 months, I would say 5 months. Okay, so though your exam is in the month of June, you always have to target the INI-CT May exam as your final exam. Okay, so let's have it as 5 months period that you have in your hand. In this 5 months, your target should be to have a conceptual understanding of all 19 subjects. Okay, and let's be clear about this. Do you think anybody on this earth can finish all 19 subjects and say with confidence, yes, I've done all 19 subjects, I'm ready for the exam? Nobody can do that. Okay, so it should be all about smart work. You should understand that you cannot be happy. You cannot say, I will be happy only after I finish all 19 subjects. In that case, you will never be happy. So I would say, celebrate every small successes. Okay, even if you finish one topic for a day, be happy about it. Pat yourself for every small successes. Pat yourself for you learning a particular concept. Pat yourself whenever you understand a clinical finding, because that is the only way you can maintain sanity. Okay, because I've always seen, whenever I go for offline classes, I've always seen students being very dull, very sad, on a self-sympathy mode. And even after I've taught like 1/4 of the subject, they would be very dull. When I ask why, they would say, I've learned only 1/4 of biochemistry, I have 3/4 to complete. Yeah, This is the state for all of us at any point in our life. If you ask me, have I finished biochemistry? I've not finished biochemistry. I have so much more to learn. So if you're going to feel like I will be happy only after I finish all 19 subjects, you will never be happy. So my take-home message number 1 for all of you is to celebrate every small success. Take-home message number 2 is your goal. Your goal should be to have a conceptual understanding of all 19 subjects. Okay, how is that possible? That is possible only when you watch all videos, right? So you have many resources in hand. So you choose any resource that you want. And in all those online resources or offline resources, there are videos or there are offline sessions. So take a resolution that you will watch every video of a particular subject, and you have to be mindful when you do that. Okay. And after you watch the video, what will you do? You reinforce whatever you have learned using the notes that is provided for that subject. After that, what are you going to do? You're going to work out the Q bank. Only when you complete all these 3 steps for every topic, you will get the confidence to say that, yes, I've understood this topic. If I see a patient based on this topic, I will be able to manage the patient. So for you to get that confidence, you have to follow all these 3 steps. Okay. And I can hear many of you asking me, if I do all these 3 steps, it takes its own sweet time, right? And you get anxious every time you're not able to complete it within a stipulated period of time. You get anxious. Let me tell you, anxiety reduces productivity. Okay. So yes, you have to time box yourself. Yes, you have to schedule. You have to have a schedule for yourself. As I said, you have 5 months. Out of the 5 months, the last 1 month is for the revision, right? So if just have in mind, you have 4 months. And out of these 4 months, how are you going to time box all 19 subjects? That is, it should have an individual variation, right? It is not based on whether a subject is a big subject or is it a small subject. I don't believe in that stratification. I would say it is based on how you have learned a particular subject in your undergraduation days, or how you have learned a particular subject till now. So how will you know which subject you have learned and which subject you have not learned in a proper way? You will have an understanding of that if you write a grant test. Okay. So many students, I've heard many students saying, I will start writing a grant test after I'm done with 1/3 of the syllabus, after I'm done with half of the curriculum. Okay. So when is the right time to start writing grant test? Day 1, right? Day 1 of your preparation. I would like to tell you all, past is past. Okay. Whatever has happened till now has happened. Just imagine or visualize that you're starting from today. Okay. I mean, if you have completed many subjects till now, be happy about it. Even if you have not completed many subjects till now, don't worry about it. Imagine that you're starting from today. And from today, how is my schedule going to be? For you to have that idea, write a grant test. Which paper are you going to write as a grant test? You don't have to wait for any platform to announce a grant test. Okay. Choose a previous year question paper. You can choose something like INI-CT May 2024 or INI-CT November 2024 or NEET 2024. You randomly choose one of these exam papers. You write it as a grant test. Okay. When you write it as a grant test, be mindful. The entire 3 hours or the entire 3.5 hours that you spend in writing the grant test, you have to be mindful. You should approach every MCQ as if this is the MCQ that is coming in your final year, which has come in your final exam. Okay. So that way you will clearly understand where you stand with respect to every subject. So at the end of the 3 hour, at the end of the 3.5 hours, you know which subject you're weak at, you know which subject you're strong in. Okay, so that stratification you should have for yourself. Based on that and based on the magnitude of every subject, you frame a schedule for yourself. Do not follow any schedule that is available online. Okay, so if you ask me, I would give a schedule for yourself saying for medicine, you will need 7 days. For biochemistry, I would say you need only 1 day. Why will I say you will need only 1 day for biochemistry? Because I know for me, biochemistry is easy. For you, it might not be the case, right? So if you ask me for microbiology, it'll take forever. I hate microbiology. I would say for microbiology, it'll take forever, but that's not going to be the case for you. So based on which subject you're strong in and based on which subject you feel you're weak at, you frame a schedule for yourself that is tomorrow. It can be even, as late as tomorrow. Okay. So frame a schedule for yourself. That would be step number 1. And this is the schedule for the next 4 months. But on a day, you should have a schedule. So daily schedule is also a must, which means at what time am I going to start my day? At what time am I going to end my day? Again, I've heard people saying, you have to start very early. Some people would say, don't start early morning, you feel sleepy, you start at 10 o'clock. Again, that should have an individual variation, right? I'm a person who rises up very late. For me, the day starts at 9 o'clock. For you, the day might start at 5 o'clock. So based on your understanding of yourself, frame a day schedule as well. Okay, so that day schedule should specify these many hours I'm going to watch video, these many hours I'm going to look at the notes, these many hours I'm going to do Q bank. And apart from all these, you should get into the habit of writing your own notes. Every day you should write your notes. So when you write your notes, it should be very crisp and very clear. It need not be detailed, because that is the note that you're going to revise in the last 1 month. Do you get it? So writing notes is essential. Please don't get somebody else's note. And if you look at it, you won't be able to understand it. Whereas if you write your own notes, you will know, okay, this is the mistake that I did when I wrote my grant test. This is the mistake that I made when I attempted the Q bank. So that will be in your memory forever. Okay, so write your own notes. And apart from this, you might think I'm being very ambitious when I say this. On a day, right? Every day you should have a grant test related activity. What do I mean by grant test related activity? You should write 1 grant test every 15 days. Okay, because you have only 4 more months for studying, 1 more month for revision. So in these 4 more months, you have to write religiously, rain or shine. Okay, whatever happens, you're not going to skip this. Every 15 days, you're going to write the grant test. You should fix the time wherein you're going to write the grant test. That time should be the time of the day wherein you're least productive. Okay, you know that, right? For yourself, you might think, okay, between 2 and 5:30 p.m. is when I'm least productive. So between 2 and 5:30 p.m. is devoted only for grant test related activities, because when you're writing a grant test, what happens is you have a higher level of adrenaline drive. So even if you feel sleepy, the sleep won't even try to come near you when you're on an adrenaline drive. So Monday, for example, Monday, you're writing a grant test between 2 and 5:30 p.m. After 15 days, on the 16th day, you're going to write the next grant test between 2 and 5:30 p.m. So what will you do in the 15 days in between? The same 2 to 5:30 p.m., you work out those 200 MCQs, okay, divided by 15 days. Okay, so what would it be? It would be something like 11 MCQs a day. Right? Won't you be able to do that? 11 MCQs a day, you're going to work out between 2 p.m. and 5:30 p.m. I can hear you all asking me, why will I take 3.5 hours to work out 11 MCQs? Because you're not going to work it out as 11 MCQs, you're going to work it out as 11 topics. Do you get it? Because every time we say there is a previously asked question, every time we say it's a repeat question, please mind it, it's not a repeat question, it's a repeat topic. For example, you're seeing a question on recombinant DNA technology. In that case, you should not just read the question, just read the answer and just read the explanation. What you're supposed to do is learn in and out about recombinant DNA technology, so that when you write the next grant test, if you see an MCQ on recombinant DNA technology, you will have 100% confidence to answer that MCQ. Only when you do that, you will see your graph going uphill. Because many a time students get demotivated whenever they write the grant test. They say, ma'am, you said I have to write grant test every 15 days. I'm doing this religiously, but my mark doesn't seem to improve. Right? Yes, it will not improve if you don't work on the 15 days in between. Okay, so 11 topics on a day between 2 and 5:30 p.m., which you don't have to segregate as subjects. Do you all understand that? I've seen students sitting and saying, okay, all anatomy questions I will do on day 1, all physiology questions I'll do on day 2. That's a waste of time. What are you going to do? Don't segregate them. Question number 1 till question number 11 on day 1. It can be from anatomy, it can be from physiology, from dermatology, that is immaterial. It is also immaterial whether you've already finished dermatology or not. Okay, irrespective of the level of preparation you're in that subject, take the topic, learn in and out. Okay, so that way you will be in touch with all 19 subjects throughout. Otherwise, what would happen is, if you're learning, say, anatomy initially, okay, let's just assume that you're going to start only from Jan first year preparation, and you're going to start with anatomy. You're finishing anatomy in 5 days, and then you're progressing to physiology. February first week, you will not remember anything from anatomy. Okay, because that is how your brain works. Okay, whenever you forget something, please don't be harsh on yourself, because that is how your brain works. Brain is resistant to storing information. Do you want your brain to be resistant to storing information? Can I hear an answer from you? Do you want your brain to be resistant to storing information? Yes, you would say yes. Otherwise, what will happen? Any trivial information that you come across will get stored in your neocortex, so that essential information will not find space to get stored in the neocortex. Do you get it? So this is an evolution. During evolution, your brain has developed a resistance to storing information. You have to overcome the resistance. So when you feel that you're not able to memorize something, pat yourself. I have the most evolved brain on this earth. I have to overcome this resistance. Okay. So how will you overcome that resistance? Just by repetition. There is no shortcut to memory. It is just repetition. For example, a biochemistry topic. Okay. If you ask me, even if you wake me up from the deepest sleep ever, okay, I will be able to tell you all facts. That doesn't mean I have the greatest brain on earth. That doesn't mean I have the greatest memorizing ability. It is because starting from 2006 till now, I must have repeated every topic like 1,000 times. Okay, so I'm not great. I'm not great in anything. It is just about the repetition. Okay, so it is all about repetition. It is all about hard work. It's all about smart work. It is more of discipline. Do you understand this? It's more of discipline, grit. So if you're asking me, okay, I did not learn my undergrad. If you're saying you did not learn your undergraduation days the right way, does that mean I will not be able to get a good NEET PG rank? No. Yeah, you have all the abilities to get a good NEET PG rank. Even if you had not learned anything in your undergraduation days, that is my assurance to you. Because personally, I have seen many students who did not do a great job in undergraduation days, but they have been able to get a good mark and a good rank purely because of their perseverance, purely because of their grit, purely because of the discipline with which they approach this exam. Do you get it? So forget about what you have done so far. Forget about how you learned in your undergraduation days. Even till now, you have not learned anything. Still, you have 4 more months to study. 1 more month for first revision, 1 more month for the second revision. Okay. So if your aim is INI-CT, you should have INI-CT May 2024 as your target. Based on that, 4 months, you have a schedule. Every day you have a schedule. You stick to it. Okay, I do understand that you will have lots of distractions, right? So I know that you have Instagram. I know that you have Snapchat. I know you have so many social media platforms which can be considered as distractions. Let me tell you this: for every generation, there is a distraction. Okay, in my days, Of course, we did not have Facebook. We did not have, I think we had Facebook. Yeah, we had Facebook. We did not have Instagram. We did not have WhatsApp. We did not have any of the other distractions. But our seniors and our elders used to say, you are the spoilt of all. Yeah, you're being spoilt by fashion TV. Yeah, those days it was FTV, MTV. So all those, so we had our own distractions, right? That doesn't mean we were spoiled. That doesn't mean we lost our focus. So don't worry about any of those distractions. Please don't say, I have deactivated Instagram because I'm focusing on my exam. You don't have to do that. You can be everywhere. Still, you can focus on what you're supposed to do, provided you have a schedule for yourself and you stick to that schedule. And you should not get demotivated whenever you're not able to meet that schedule also. Okay, because just remember, you're also a human. You are putting your all efforts. Even then, if you're not able to meet like 100% of the schedule, even if you've met 90% of the schedule, pat yourself. Because ultimate goal, I told you, is to become a good clinician. And I would say even higher than that, the ultimate goal in your life should be to be happy, right? Ultimately, what should be a goal? Your goal should be to be happy. Okay, and for you to be happy, you should appreciate yourself for every small successes. Anxiety reduces productivity. The day you fix your goal as a rank, the day you fix your goal as a mark or a seat or a college, that is when anxiety creeps in. Okay, so your aim should be to, okay, today I've understood why sodium benzoate is given for hyperammonemia. All along, I did not understand that. Today, I've understood it. So I'm much better than yesterday. Okay. So that way you appreciate yourself, be happy, be productive. And so if you have this focus and grit in your mind, irrespective of whatever you have done so far, I'm very sure you'll come up with flying colors. Okay. So I was telling you about writing grand test, right? So if you follow this pattern, 3 hours a day, grand test related activities. Once in 15 days, you're writing grand test. You're going to write as grand test previous year question papers. And you're going to complete the last 4-year INI-CT papers, last 5-year NEET PG papers. And if you get time, last 2 years FMG papers, right? If you do this, you will come back and thank me. Okay, because I've seen some students have followed this religiously and they've come up with flying colors. Okay, so don't worry about what has happened. What has happened has happened. Let's focus on what we can do from today. Okay, and if you ask me how to prepare for biochemistry, how many of you like biochemistry? Can I know?
No comments, ma'am.
No comments, is it? I can see how many of you have raised your hands. Doctor likes it. Wow, Komal, biochem is your favorite. Cyan is very frank and very open, saying that I don't like biochemistry. Shankar does not like it. It's very volatile. Shagun says it's very volatile. It's okay after multiple reading. I like only the clinical part. Very good, Karthikeya Jain. He says it's the most strong subject, very poor at biochemistry. Once you understand biochemistry, it's interesting. So good to see all your answers. This is not new to me, okay? Except carbohydrates, rest all topics are good. My college department was very strict, so we were forced to learn, but that was a blessing. Great, very volatile. So this is not new to me because I studied it from you. I am so happy to hear that, Komal. Yes, taught in a clinical way. So this is not new to me. Wherever I go, whichever batch I meet, hardly 1% of students like biochemistry. Thanks, doctor. Thank you. And is it the fault of the subject? Definitely no, right? Is it? It's not just about sex. Yes, that is my favorite statement. Biochemistry is not just about cycles. Okay, so it is not the subject. It's not the fault of the subject. It is, I would say, it's primarily because of your seniors. Okay, I know many of your seniors would have told you that biochemistry is volatile, biochemistry is full of facts. So don't learn biochemistry from the beginning. You have your study holidays. During your study holidays, you just learn all those cycles and pathways. You will be able to clear the exam. This is the statement that you have heard, that you would have heard during your undergraduation days. And even now, because of professors in college. Okay. So even now for your NEET PG preparation, I know many would have told biochemistry is volatile. Don't learn it in the beginning. Learn biochemistry at last, and then you will be able to answer those MCQs. Okay. So let me give you one advice. Okay. Do not follow anything which your seniors say. You get it from me? Do not follow anything which your seniors say, because your seniors have not achieved much yet. They will achieve in due course. They have not achieved much yet. They also don't have a clear understanding of what is what. Okay. And for those of you who think biochemistry is full of facts, do you think microbiology has full of facts or biochemistry? Can I get answers from you? Microbiology or biochemistry? Micro, right? Very good. No, doctor, this is not biochemistry, it's microbiology. Yes. Do you think pharmacology has more facts or biochemistry? Pharmacology. Yeah. Do you think medicine has more facts or biochemistry? Obviously medicine. Okay. So all these are myths. Thanks for answering. Very good. Pharmacology is more hard, right? I know. So whatever you're being fed as an information so far about biochemistry is a myth. Okay. If somebody says biochemistry is a preclinical subject, please vehemently oppose it. Okay. Because will you be able to treat a critically ill patient without electrolyte values? Can you all give me an answer for that? Will you be allowed to treat a critically ill patient without electrolyte values? No. Right? Yes. Will you be allowed to treat a patient in CCU without ABG values? No. Right? Leave alone all these extremes. You might be treating any patient. Your patient might be suffering from infection, inflammation, trauma, neoplasia, that is immaterial. When you say that you're managing a patient, you're actually managing the patient in such a way that you establish biochemical homeostasis of the patient. Okay, without renal function test, without liver function test, without cardiac profile, without amylase level, lipase level, without any of these investigations, you will not be able to manage your patient. So biochemistry is not just about cycles and pathways. Okay. So when you learn biochemistry, please learn biochemistry in an applied manner. When you start doing it, you will start seeing the other side of biochemistry. Okay. So whenever you're going to start learning biochemistry, please watch my videos, which are available free. Yeah, I'm not saying you have to buy an app, you have to do this, you have to do that. Just watch my videos, which are available for free on YouTube. Okay, for example, if you're starting genetics, there is a free video on YouTube, which is biochemistry in 1 hour. No, genetics in 1 hour. Okay, so watch that video and then start working out MCQs. And that way, I've taught almost every topic free on YouTube. Watch that and then start learning the particular topic, and then work out QBank. And then for spaced repetition, right? Spaced repetition is you have to repeat a particular topic multiple times. That spaced repetition is going to happen because you're going to write grant test. So every time you write grant test, you're going to attempt at least 10 MCQs in biochemistry. So if you learn that particular topic, your brain keeps getting stimulated. In that case, you will not forget biochemistry. You will stop hating the subject. Okay. So if you ask me in what sequence should you learn biochemistry, you start learning biochemistry with cell. Okay. In cell, I'm not asking you to go and learn that mitochondria is the powerhouse of cell. Right? That is not just about cell, right? So when I say cell, you take cell and then you learn about the pathways happening in various suborganelles. Glycolysis happens in cytoplasm. Fatty acid oxidation happens in mitochondria, so that you get a big picture of what is happening in a cell. Then learn about marker enzymes. Okay. Then you start learning chemistry of carbohydrates, and then you learn metabolism. Then you learn inborn errors of metabolism. That is when you can say, yes, I finished carbohydrate chemistry, I finished carbohydrate metabolism. Okay. Many of you find learning inborn errors of metabolism to be difficult only because you don't learn in the sequence. Okay, if you learn chemistry first, and then if you learn normal metabolism, and then you learn glycogen storage disorder in an applied manner. Yes, there is a video on glycogen storage disorder also available free on YouTube. Okay, so watch that. Then you will see like, okay, biochemistry is so applied. Biochemistry is so understandable. Okay, so only because we skip all these steps and go and start learning about glycogen storage disorder, you say, how will I be able to make a diagnosis of this disorder when the disorder is so complicated? Okay, so, and the last topic to be learned is vitamins. I've seen many students starting with vitamins. Okay, you will not be able to understand vitamins if you don't know the metabolism. Once you complete metabolism, when you learn vitamin, it will be like a summary of all metabolic pathways, because all water-soluble vitamins play a major role in metabolism. Okay, so vitamin should be the last topic that you learn. That should be followed by genetics. Okay, and even in genetics, you should not all of a sudden start with recombinant DNA technology. You should not all of a sudden start with polymerase chain reaction. In that case, everything will sound like Greek and Latin. Okay, what should you do? You should start with what is a nitrogenous base, what is a nucleoside, what is a nucleotide, learn about chromosome, learn about gene, right? Then you learn about any technique, then it will be a cakewalk. Okay, so the sequence in which you learn a subject matters a lot. This is about biochemistry. Similarly, any subject that you learn, you should follow a sequence. Okay, if you do that, you will start relishing the process of learning. Okay, the day you entered into medical college, yeah, be it a voluntary decision or an involuntary forced decision, the day you entered into medical college, you have signed up for lifelong learning. Do you all agree with me on that? You have signed up for lifelong learning because medicine is such a rapidly evolving field. It has to be rapidly evolving given the fact that the type of disorders that we face keeps changing. Okay, so lifelong learning is not going to be that easy. And when do you think that's possible? That's possible only when you start loving the process of learning. Okay, you should not think of learning as a burden. Okay, every time you learn something, be happy about it. Okay, only that way you will not feel burnt out. Otherwise, when I've seen many of my colleagues, many of my seniors and some of my juniors saying, I hate medicine, I'm not liking this field at all because I feel burnt out. Why do you think they feel burnt out? Because they don't like what they are doing, right? When will you start liking what you do? You don't have to be born with a spark, right? You don't have to be born with a spark for a particular subject or for a particular field. You will be able to develop a passion if you know what you're doing. Do you understand this? Only when you know clearly what you're doing, you will like it. If you're going to just follow what your seniors say, just because your senior consultant once said that, let me take the same example. Your senior consultant once said, for a child with hyperammonemia, start IV sodium benzoate. Okay, you're memorizing it. Every time you see it, you're starting IV sodium benzoate. Will you be liking that? You won't like it. Instead, if you know why are you starting IV sodium benzoate for hyperammonemia, you will clearly know when should I start, when shouldn't I start. It should not be like you just memorizing the list of indications, list of contraindications using a mnemonic. Do you get it? Mnemonic is a tool for learning. Do you understand this? It's a tool for learning. That should not be the only way of learning. You should know why I should give sodium benzoate for urea cycle disorder. You should know why I should not give sodium benzoate for a decompensated liver disease. The day you understand why, you don't have to memorize it. You will never forget it. Do you all understand that? So take a resolution today that you will always ask why. right? You will always ask why for any fact that is being told to you, for any concept that is being told to you, you will seek and find out an answer, right? If you develop that habit, then you will become passionate about any field that you enter into, right? That is why when somebody said, I don't know which field I should get into, that's the best way, right? Have an open mind about any field that you want. The only thing that you should do is, what is my skill set, right? You should know if you're good in surgery. You should know if you're good in analytical thinking. You should know if you can look at a slide and find out what the slide says. So everybody has got different skill set, right? For me, visual cue is not that great, right? Whatever visual cue you give me, I will not be, for example, till today, I've never diagnosed any slide, right? I've never been able to identify any pathology slide till now. Yeah, because I know I'm not great at it. So you should know what you're good at. You should know what you're not good at. Based on that, you should have a list of choices, right? That is what you should have now. After that, you might, based on the rank that you get, based on the mark that you get, you might choose one of these choices, but you will be happy because you know you're good at it. Okay, so that should be the only thing that you should have in mind. You should not say, I should get first 10 ranks, I should get first 100 ranks, I should get first 200 ranks. Everything else will fall in place if you like what you do. Okay, if you start enjoying the process of learning, everything else will fall in place. You don't have to focus on rank, you don't have to focus on mark, you don't have to focus on seat, you don't have to focus on the college. Okay, just fix your goal is to be happy. Fix your goal is to become a good clinician, right? And then everything else will fall in place. Okay, so this is what I wanted to tell all of you. Is there anything else that you want to know from me?
Yeah, guys, you can unmute yourself and you can ask your queries, or you can drop a message in chat box if you are not comfortable.
Yeah.
By the way, ma'am covered everything in this full 40 minutes. Everything is summarized.
Yeah. Thank you. Any other questions? I don't see anything in the chat box for now. Should we focus on GT marks? No. Grant test is not to assess your performance, right? Grant test is not to assess your performance. It is to improve your performance. That doesn't mean you should not look at your marks. Yes, you should look at your marks, because only then you will see whether your mark is going uphill or downhill. That is the only thing that you should observe. From grant test 1 to grant test 2, there should be an uphill. Even if that does not happen, please don't lose hope. Okay, keep working on it. And writing grant test helps you in multiple ways. One is time management, right? So again, don't follow any of the time management YouTube videos that are available online. It should be you who's defining your time management. For example, once you write grant test multiple times, then when you write your final exam, you will involuntarily know that usually by this time I would have finished 50 MCQs. Today I have not finished 50 MCQs by this time, which means I should buck up. I should improve my speed, right? So all of this should happen involuntarily. It should not be based like, okay, I should memorize in the first 1 hour, I should finish 75 MCQs, right? It should not, nothing should be memorized. It should happen involuntarily. And mark does not matter. The improvement matters. Anything else? Can you repeat the sequence to study biochemistry? Of course, I can do. Should we use revision videos if concepts in the subjects are very weak? If your concept in a particular subject is very weak, I would suggest that you watch regular videos. Because even me, when I take a rapid revision video, I would like to tell you a particular topic in a concise manner, wherein I will only focus on the important facts and the important concepts that you're supposed to remember. Whereas the same topic in the regular video, I would explain everything conceptually. So if a particular topic concept is not great, then please watch regular video. Repeat sequence to study biochemistry. Start with cell and then progress to chemistry of carbohydrates, normal metabolism of carbohydrates, inborn errors of carbohydrate metabolism, and then progress to lipids, progress to proteins, and then it is vitamins. The last topic has to be genetics. Should we stick to only one platform? Yes, I would strongly suggest that. But again, you can have subject-wise favorite faculty for yourself. Okay, so you are blessed in multiple ways. Every faculty's video is available online. Okay, so before you choose a particular faculty for a particular subject for yourself, if you have confusion, then watch their YouTube videos, because I would want somebody who teaches concepts more. I would want somebody who connects every concept clinically. Okay, whereas you might be a person who wants it in a different way. I would want a faculty who teaches slowly, who teaches it in a particular pace. You would want it to be taught in a faster pace. So everybody has got a particular preference, right? So based on your preference, you can choose a faculty. And for a particular subject, based on the choice of faculty, you can go for a platform if you have that liberty or luxury. Otherwise, choose one platform. Don't get into any fear of missing out mode. Okay. Every faculty who's chosen for any of these platforms have a minimum of 10 years experience in teaching NEET PG aspirants. So all of us are teaching everything based on a standard textbook. So there will not be much of variation across platforms. There will not be much of variation across the subject that is being taught, across the notes that is being given. It is all about the preference in terms of the teaching style. So once you choose the teaching style, if you're very particular about a particular teaching style, then you choose the faculty, choose a platform. Otherwise, I would say stick to one platform, learn it, keep working Q banks. Okay, it is all about working out MCQs, because answering an MCQ is a skill. We all understand that answering an MCQ is a skill. Just because you know a fact or a concept, it does not mean you will be able to answer an MCQ based on that. Okay, so this skill comes purely by practice. So spend most of your time working on QBank, working on previous year question papers, writing grant tests, then you will be able to succeed in this. While solving questions, there comes many topics which feel distant to PYT. Should we add them to notes or just let them pass? So it is all about knowing something about everything. Do you all understand that? It's all about knowing something about everything. Still, there will always be a question which we have never come across before. But I would say most common is always common. Do you understand that? Most common is always common. So focus first on previous year topics, previous year questions. Once you know that you're very strong in all these previous year topics and questions, if you think your neocortex has more space, then you can focus on all these rare questions. In every question paper, there will be at least 5% of the question which has not been previously asked. Even if you don't answer those questions, your rank does not get affected. You all understand that? Even if you don't answer those 5% rare MCQs, your rank does not get affected. But if you don't answer a repeat topic, then your rank definitely gets affected. So your focus number one should be on previous year topics and previous year questions. Beyond that, when you start revising, right? When you start revising, then you can focus on these rare MCQs. Don't waste your time initially on working out these rare questions and rare topics. What is the correct method to review GT? Some questions in GT are very vague. That is why I said choosing the question paper for previous grant tests. Choosing a question paper for writing a grant test is essential. Just write down previous year question papers as grant tests. All the platforms that you have provide you previous year question papers. Okay, write that as a grant test. When a platform gives you a GT, they want everything to be covered. So they will always give you some tough MCQs so that they get you prepared for those rare MCQs as well. But as I've been repeatedly telling you, common is always common. So previous year topics, previous year questions is what you should focus on. So when you work on previous year question papers, then you will not face this difficulty. I hope I've answered that question. How much time should we give per subject, and then how to revise on regular basis? I think I already answered that, Sadaf Sheikh. The time that needs to be allotted for every subject should be decided by you, depending upon whether that subject you're strong in or you're weak in. Other than that, we also know how many MCQs are being allotted for every subject. For example, medicine, yes, it has got a major contribution in any question paper. So for medicine, you should definitely have a longer period of time. I would say for medicine alone, you would need 7 to 8 days, provided you have the grit to sit throughout the day, right? And you have no excuse but to sit for 12 hours a day reading, right? I might sound like a cruel person, but you have to sit at least for 12 hours a day just for reading. And if you do that for 12 hours, then 7 to 8 days definitely is necessary for medicine. But again, if you have learned this medicine already during your internship, you have learned medicine already during your final year, use the same app at that point of time, then you might need lesser duration. Okay, so you have to make a decision on how long you want for every subject based on whether you're strong in that subject or you're weak in that subject. And for working out grant test also, I told you, right? The 15 days in between 2 grant tests, you're going to divide those 200 MCQs as 11 MCQs a day, as 11 topics. You have to review that paper. Only then you will see an improvement in the mark. What about medicine? I just answered that. As it is vast, and also you can cover some questions from patho, pharmacology, physio, yes. How to approach medicine. There is a reason why anatomy, physiology, and biochemistry are taught in the first year, right? When I said for every subject, you should follow a particular sequence. Even subjects, I would say you should follow a particular sequence, right? Start with anatomy, physiology, biochemistry. I do not agree with people saying start with big subjects, right? And then you can end with a smaller subject, or saying morning you learn a big subject and then evening you learn a smaller subject. I would say that should be a reinforcement of a particular subject over a particular period of time for your neocortex to absorb it. Okay, for everything there is a physiological basis. So I would say you start with anatomy, physiology, biochemistry, go in that exact order, so that you will not have to go back and read. Suppose you're starting with medicine, then you will have to open microbiology, you will have to open pharmacology, you will have to open physiology, biochemistry to understand a particular concept. Instead, if you had followed a sequence, then when you come to medicine, it will be only like a summary, right? And then you will have to memorize and understand few clinical features. You will have to just summarize it in medicine. So follow a sequence in which you learn every subject, even in subject follow sequence in which you learn all these topics. And it's all about science, right? There is no magic behind it. Don't follow any shortcuts. If you follow the sequence, if you follow a particular science behind everything that you do, then you will like the process and it'll be easier for you. Okay.
True, ma'am. Yeah.
Manjunath has raised his hand. Does Manjunath have anything to ask?
Yeah, I think we have covered up everything.
Okay.
Yeah. Yes, ma'am. Yeah. So covered everything. Thank you so much, ma'am, for your time. And it was wonderful session. You covered everything without even asking. You covered everything from GT to questions to how to solve everything you have covered. Thank you so much for this session and your time, ma'am. Thank you so much for joining.
Thank you. Thank you all.
Thank you, ma'am.
Thank you so much, ma'am.
My pleasure.
Thank you.